Fambodem, and welcome to another edition of the Wellness Talk, which come to you every Thursdays from 6 p.m. to 7 p.m. on Redeemer Television, channel 25. Here in a Wellness Talk, we watch everything physical, mental, emotional, and totally spiritual aspect of your well-being. Because we believe, say, Motaman, if you not they healthy, then you not go well as well as we don't the people then they sing. Well, before we push the program, go before we want to look about God in word inside Ephesians 5 verse 3. Ephesians 5 verse 3, we say, but fornication and all uncleanness or covetousness, let it not be once named among you, as becometh saints. Well, Fambodem, so I take welcome you to today's edition of the program, and for today we topic na STI, a major concern for the public. STI, a major concern for the public, and that's na sexually transmitted infection. And of course, as always, we get Master Sabi person where they can tell we more about this topic here. So you go quickly introduce yourself, sir.
Fambodem, good evening. Me na Dr. Jesse Amara. And are there by the grace of God for explain to we waiting at this sexually transmitted infection today.
Okay, so Boku Tenko, you join me today at the studio, and don't forget, say, if you want to be part of the program, you can send text message or call, or you can send a comment or a feedback. Now we Facebook page Redeemer Television, you can drop a comment and you can tell me what you think about the program. So we want to go before, of course, this now one thing where we don't get a lot sexually transmitted, infection, and also one for waiting at this sexually transmitted, infection or disease.
All right, sexually transmitted infection. This then sickness they hold the contact predominantly to sexual activities, predominantly, okay. But we can also get to blood transfusion or sharing of needles, okay. But predominantly we get through sexual activities,
Okay.
especially unprotected sexual activities.
Okay, so I get a couple of questions inside about, maybe we first of all understand and know more but then sexually transmitted infections then, so we did talk about like more waiting at the types them and all.
All right, okay, so I know say most of we don't use for a sexually transmitted disease, okay, but appropriately infection na in the word for use. Why? Because you go find out, say, as we they go along, most of the infections they are we person get them and not they even know say it get them, okay, which we call asymptomatic disease or infection. Asymptomatic means say you get the virus or the bacteria or whatever they cause them, but you not get no symptoms. You do everything normal. Well, you did do everything, but the one at times no symptom. Okay. So according to studies, even about 50 to 70% of women can get this sickness here without any symptoms. And we find out say a more common among women than man. We can broadly group the infection there by weighting the cause them into 4. All right.
Okay.
1 na bacterial them. We get the bacterial cause. 2, we get the viral cause when a virus them. 3, we get the parasitic cause, parasites them, and then the cause them.
Okay.
Then 4, we get the fungal cause.
So we can go over, we get bacteria, we get
the viral cause,
the parasite, and the fungi.
Yeah.
Okay. So go ahead, sir.
All right. So under the bacterial cause, you get a lot, but the most common one they will go talk about now one we call chlamydia trachomatis. Okay. The next gonorrhea. Third, syphilis. All right. As I say, the bokubo. Then 3 now they're more menace and are they more common
for bacteria.
For the bacterial cause.
Okay.
Then for the viral cause, we get HIV. we get hepatitis B,
Okay.
we get herpes simplex virus, we get rubella, cytomegalovirus.
Wow. Okay. Okay. But let's go.
Yes, so for the parasitic cause,
Mm-hmm.
we get what you call toxoplasmosis,
Okay.
okay, with the causative organism now toxoplasmosis gondii, okay, we now mostly from domestic cats.
I don't understand.
Domestic cats now from mostly where they get them from.
Like they get parasite, like the spit or the
From the
fur
feces.
or from the feces.
Yeah.
Okay.
If you congest the cyst, or what you call the egg, in Creole for let people understand.
Okay.
But we can call them in cyst, the cyst. So the egg, the bacteria, the parasites can lay an egg inside the pus in toilet. So where you ingest them, whether through you contact them with the food, since now also the men and I make say domestic,
Yes.
okay, you eat them. So now the major way that they have for contact that one day. And a real menace for a pregnant woman. Alright? Because now one of the or touch infections the way they cause congenital malformation. What in congenital means? It means say when you born the begin and not normal. Okay?
Okay.
Alright. So the other parasitic infection now what you call trichomoniasis. Alright?
Okay.
Then for the fungal now candidiasis. Alright? So if it affects the penile area, we call them ballantitis. That inflammation of the penile surface. Alright. So these now some of the most common infections them, or the STIs them, we common way can be transmitted through sexual intercourse.
Okay. I should say like most of the I go include myself, like we the public we just used to gonorrhea, syphilis, HIV, hepatitis B, but all the rest now we call I think so we so familiar with them. But we want to go forward. Of course we don't understand say this them very dangerous sick, very dangerous infection, especially to body, especially where you didn't even know the symptoms. But like in your first statement, when you did stuff, you say one way, another way where person will get not through needles or blood transfusion, or as you say through sex, that like the basic, the bottom line through sex. And then you say blood transmission, and then through needles. Is it that the entirety of the person they get the infection, like blood now, water now, this now, that? Because I can think that's why some people them can even think and say we pussy sweat and one thing yeah, and like we pussy sweat they touch me. You understand? So is it that the entirety, everything concerning the person in system don't be affected by that infection, whether parasitical, fungi, or the others we don't name, or is it that you get stages them?
Well, of course you get stages them. And
Okay.
it depends on who's of the bacterial, viral, or what if you infected with, okay? And the stage. So typically for most of them, they not can be transmitted to contact with bodily with sweat.
With sweat and not with urine either, or physical touch
No,
at all.
except with sexual fluids.
Fluids. That's anything from the inside.
Yeah, from the
blood.
Yeah, exactly.
Okay. Sorry, you can continue, sir.
Alright, okay. So from the sexual fluids then, okay, like the semen, vaginal discharge. Alright. So now if you come in contact with them, there is a possibility, except for like hepatitis, which can be transmitted through sweat. And I make us say it depends on the one them we you talk. Alright.
Okay.
But as I say, predominantly now through sexual intercourse. I make a call as sexual transmitted infection. So that way they talk about urine indifferent. Okay, the genitalia consists of the reproductive angle and the genitourinary angle. So if now the urinary system complicated, then mostly we they call a waiting urinary tract infection, UTI, indifferent.
Okay, yes. I think we don't get a guest, we can clarify that. We don't get. So as you don't start for say, waiting as somebody stages them for this sexually transmitted infections.
All right. Enough fear for ask say what are the stages of STI, because they all get different incubation period, but broadly we can classify them in the asymptomatic stage and the symptomatic stage. Okay, in other words, the asymptomatic stage, that's where you get no signs, no symptoms, you're fine. Then the symptomatic stage, now where you don't begin show signs and symptoms, and at that time now you can safely say na sexually transmitted disease. Okay, so disease always they go with symptoms. All right,
Yes.
whereas infection not always the good symptoms. So now the difference now between STI and STDs. So for let's say STDs, if we don't begin get infection, if we don't begin get signs and symptoms of the disease.
Okay.
Yes.
Okay. So when the person they in an STI stage, because as per what I don't understand now, they get the STI stage before you go the STD stage. Okay, thank you. So when the person they in an STI stage, usually based on my understanding, when the earlier the less chances, or the more chances, I say the more chances you get for treat them early and get better soon, and then the later the less chances we could get for get them treated, right? So when person they in this let's say STI STI stage, or STI, yes, let's just put it this way, and then STI stage, is there any danger when in the cause like now the system or to the person, because you not go get way for no say now this they affect you, except of course you go for test, right? So what in get any danger, potential danger, apart from in transmitting the disease to somebody else, but any danger when it cause to the person of himself?
Of course, when it all when you get infected, as I say, mostly we can pick them up from routine examination.
Okay.
Maybe you go feel say self now malaria you get. Okay, you go to hospital, then we say okay, well, I'll do lab test. Now you make enough fine for a doctor. People they always not want go hospital. They say when they go hospital, they go tell them waiting they not get. Way very wrong. So that routine laboratory test where you go to hospital, what we do, now I'm gonna make law pick them up, especially for woman them. You see, they always say for woman them, because the anatomy of man is totally different for woman. Okay? And the bacterial and virus them somehow they able to thrive more in women than man, because of the structure of the genitalia. How God make woman. One woman in own parts in short to it open to the outside. Whilst man in kind of long and narrow. Alright? So for let the virus, bacterial, parasite or whatever able go and colonize, it take time. And mostly when man gets infected, the symptoms that they show quick than woman. Alright? Whilst now woman it go take time. It go don't take a chronic stage before it begins show, because the tract in shorter to the inside, alright? And then get a normal flora at the vagina, which can be altered based on that. And that alterations they can cause other infections then. So woman they get the higher propensity for being infected. But mostly now man then can give woman then the infection rather than the other way. So if you compare say now the woman nine they give the man, mostly na man. And we'll come to the risk factors then. We'll not candidates. So this is not just a pro bono. Alright? Okay.
So make we go now to the symptomatic stages. waiting at somebody signs them where una go able detect, or person go able detect quickly say, oh, I need for go check for do an STD check or something like that. Waiting at somebody's symptoms the way person go look out for.
Okay.
Mm-hmm.
So before we go to the signs and symptoms, you go find out about the risk factors. Okay.
Well, let's talk about the risk factors.
So for the risk factors,
Mm.
one, if you're a woman, you get risk for being infected. High risk. Okay. But if you're a young person, 25 years and below, all right, that's back na a risk factor. If you're not somebody where they drink alcohol because it cloud the judgment, so that's a risk factor. All right. If you not somebody where get multiple sexual partners, you see where the Bible can encourage we say Lord deceased from fornication, not of God is sick. It's not like now God to be affected. Now for your own good one, because the more you change sexual partners, then the more you prone for get infection. Then you will practice unsafe sex. Okay? That's where they use barrier method, that condom. Alright? That self can predispose to STIs. Okay? Then you in a I know say na Bible na church homosexuals, okay? Higher risk for STI. Why? Because the anal cells them, that's the thing them, the lining of the side exactly. In outer leg, the vagina. Alright? So for there, if person gets sickness for transmit them to the next quicker. Alright? Then if you know somebody we get more we now what we call transgender. Yes, transgender. That's definitely risk factors. Okay, so since I don't talk about the risk factors, then I can come now to the symptoms. Well, the symptoms then, although you get overlapping symptoms, but some of them get waiting, we can say, okay, this is stand out for this. So let I just give a general overview. So like for gonorrhea, I know say most of we know waiting the cause gonorrhea, not also. If I ask some people they're gonna, so the bacteria call Neisseria gonorrhea, alright, and gonorrhea, like gram negative rod, alright. In mostly it cause urethral discharge. In both man and woman, you did discharge like saying a tough. They put tough. So now one of the signs them done they for say this na gonorrhea. Also, we get what we call intramenstrual bleed. That you don't see your period though. The way it takes small, you begin pull blood. Before self, your next period for start. Okay. So in a one thing where they should say you are infected, although at times this fibroid self can cause intermenstrual bleed, but in self now one thing we can cause that. Okay, especially in woman. Why I still stress in woman because woman can get her in no. Mostly they can pick them up if they get sexual intercourse with a man. Okay. Then the man within 1 or 2 weeks when at the incubation period of gonorrhea, the signs they can show. Now that make if man go to hospital or woman go to hospital, it gets gonorrhea, they say go count your partner now treat her. Because you the man go some man they wicked, they go treat himself and not tell the woman. And as we come to the complications, you will find out why we need for treat early. Also, with gonorrhea, it causes what we call stomach cramps in women. The belly, the heart, the cramp. Then we get what we call pelvic inflammatory disease. That's pending in more severe, and it can lead to ectopic pregnancy. That you get belly because it don't wound, it don't damage the womb. The belly not able to sit down. Side for sit down, it go sit down other side, and then the alone self na a emergency will cause death if you not treat them fine. Okay.
Yeah.
Then we come to chlamydia. Chlamydia is the most common infection, but people in gonorrhea mostly they know in women. Okay.
Yeah.
In the affect, of course, they all the affect. So this na individual agi because most them can be transmitted and they affect the pikin if in a pregnant woman. So let's just talk about before we come to the pregnancy. So instead they cause a discharge, urethral discharge, just like gonorrhea. And instead they cause the PID, pelvic inflammatory disease. So that make us see they get overlapping symptoms within the IEDC under. Then with that one in the cause I guess systemic manifestation is chlamydia. So the person will complain fever, all right. You go call it say malaise. That means say I dey feel sick. So the medical term for you say I dey feel sick is malaise. Okay. So you go come to hospital say I dey feel sick. All right. So for syphilis, one thing we profound about syphilis. So I don't talk of the chlamydia the cause. So I not go over that.
Yeah.
So the cause for syphilis now it's in T. pallidinum. Okay. With syphilis, when a spirochete bacterial, in the cause what you call canker ulcer. CHANCRE, canker ulcer. This ulcer in painless. Okay.
Unlike the other ulcers.
Yes. So if you compare syphilitic ulcer with genital wart ulcer, genital wart ulcer is painful. That the person wound is painful and it's tender on examination when you touch like that.
Wow.
Yes. Alright. Then we get the other one we call Haemophilus ducrei, cankeroid ulcer. It's painful. But as I say, I not be call them initially because people they don't know about them much. But instead, Haemophilus ducrei, where they cause the cankeroid ulcer, it's painful. So like that one there, now the three one they mostly we common for cause ulcer, the most common and they cause wound. But waiting differentiates them from syphilis. Syphilis is your ulcer in painless, you know the heart. Okay. The wound, but you know the person is scratch and itch.
Okay.
So we don't talk about gonorrhea and chlamydia and syphilis.
Yeah.
That's for the bacteria. They don't talk for genital wart when a viral cause. Okay. So trichomoniasis itself, the person can get a fishy odor discharge. The woman.
Okay.
It smell like fish genki.
Okay.
It can be yellowish, it can be grayish, okay, or green discharge.
Okay.
Okay. Then it itch, it scratch. With candidiasis, when a fungi cause, itself can cause itchiness, redness of the vulva. So like vulva, we say vulva for medical terms, that's for woman, always see the synado, na the vulva.
Yeah.
We see the nado. Not just put out so.
Yeah.
Alright. Of course, HIV in mostly we all know now the in a all man come inside. In there, but since it affects all side, everything it affects. All things they be affected with HIV. Okay. So you go come first. It starts with infectious cause. It begin make like say na fever. You begin vomit, rumbele. Say it come now to the sexual part and it transmit them to the pikin. So if I say what they talk, but in a one whole top now one topic now one whole day topic by himself honestly. So I make I no one go there for make at least may not suffocate the other side for talk about. Okay. So I think now those are the most common symptoms. So we get what we call arthralgia. Okay. So mostly they can affect the joints, them, the muscle, the myalgia, the muscle spins them. Okay. Person can complain say again me joints them, the arts. Mostly the woman they can complain they feel me joint. So
well, we can put doctor ourselves in arthritis or cold or what's that.
So infection, the infections then the STIs then can cause that.
Okay.
All right. So For make you get STI, you for be mostly if you not receive blood, if you not into needle breaking, you for be sexually active.
Okay, so either of the three.
Yeah.
Okay. Okay, well, if I'm put them, don't forget to the program where you they watch. Now, the Wellness Talk where it come to you every Thursdays from 6 to 7 p.m. on Redeemer Television, channel 25, and live on with Facebook and YouTube page, Redeemer Television. So we want to go for a short break and we'll be right back. Of course, this is a very, very interesting topic. We don't want to take a long power break, but we want to go for a short break. We'll be right back, and when we come, we could continue with the topic. Don't go anywhere.
Over the recent years, a good number of previously unknown superfoods have cropped up and taken the health and wellness industry by storm. We've had sweet potato, quinoa, chia seeds, avocado, goji berries. But it's time for them to move aside, because there's a new name in town: bitter cola. Bitter what now, we hear you say? If you haven't heard of bitter cola before, that's hardly surprising. You won't often find this food product stocked to the max in your local supermarket. You might have tried it before though, as it's mostly used to flavor sodas. Don't let this deceive you into believing that it isn't healthy. On its own, it certainly is. Bitter cola is a nut that can be used as a supplement for improving health and energy levels. It's found in the evergreen cola tree, which you'll mostly see in the African rainforests. In its region, it has long been used for health and medicinal purposes, and is even seen as an important cultural symbol. There are plenty of reasons why the cola nut is so widely celebrated, and in this video, we're going to cover them all. Number 1. Aids digestion. Digestive issues such as bloating, abdominal pain, and constipation can be a nightmare to deal with, and often it's best to treat the problem naturally. Bitter cola in particular is an effective natural remedy for a number of digestion troubles. This is because it promotes the production of gastric acid, which increases the effectiveness of digestive enzymes in the stomach. This helps the body to break down food more thoroughly, assisting in healthy and speedy digestion. Number 2. Increases circulation. Oxygenation, or the delivering of oxygen around the body, is vital for the proper functioning of our extremities, internal organs, skin, and brain. Adding bitter cola to your diet has been shown to improve oxygenation by increasing circulation of blood around the body. This increase in circulation can lower your risk of heart disease, as well as improve brain functioning and keep your skin healthy and young-looking for a longer period of time. Oxygenation helps cells to repair themselves, enabling wounds to heal faster and improving concentration, which is why consuming cola nuts can have such a big impact on our overall health. Number 3. Boosts metabolism. Cola nuts are a good source of caffeine, which, when consumed in moderation, has the ability to raise your metabolism by about 10%, helping you to burn energy and calories at a faster rate. Caffeine is useful for giving you that hit of energy right when you need it, by stimulating the heart to pump more blood. Bitter cola has been found to be particularly useful to people with a low metabolism, who can take the nut to improve metabolism, improving their overall heart health in the long run. Number 4. Prevents harmful bacteria growth. Unfortunately, research into bitter cola's antibacterial benefits is fairly limited at the moment. However, one study does suggest that using the cola nut might stop the growth of harmful bacteria in the body. The nut was found to inhibit the growth of a number of bacteria, indicating that it displays promising chemotherapeutic and antibacterial potential. We're sure we'll hear more about this in the near future. Number 5. Decreases the risk of prostate cancer. One of the most interesting studies into bitter cola has discovered that the nut may decrease the risk of prostate cancer. It's thought that phytoestrogens, certain compounds found inside the nut, may actually be able to kill cancer cells, preventing them from multiplying to form tumors in the prostate. We definitely need to research more into how bitter cola may prevent the disease, but what we know so far is promising. Number 6. Aids in weight loss. There are 2 ways that adding bitter cola to your diet might help you to achieve your weight loss goals. One is that the cola nut contains a good helping of caffeine, which, when consumed in moderation, has been found to suppress appetite and that help you feel fuller for a longer period of time. If you're a frequent daytime snacker, adding bitter cola to your breakfast or lunch might help you curb the cravings. Aside from suppressing appetite, bitter cola possesses a number of fat-burning properties that are linked to its ability to speed up metabolism. Including bitter cola in your daily diet, along with a healthy lifestyle and regular exercise, should help you to burn calories faster and lose weight at an increased rate. Number 7 improves energy levels. One of the main benefits of caffeine, which we know can be found in high quantities in bitter cola, is its ability to boost energy levels. We all know that person who needs their morning hit of caffeine to get through the day. And there's truth to the belief that caffeine can keep you awake and alert for longer. Notably, caffeine increases the release of adrenaline, which helps the heart to beat blood faster around the body, spiking our energy levels right when we need it. Getting your daily dose of bitter cola should help you to stay attentive and productive, no matter what daily activities are on the cards. Number 8 treats osteoarthritis. Osteoarthritis is a degenerative joint disease that can cause intense pain and inflammation in the joints.
p.m. to 7 p.m. on Redeemer Television Channel 25. And of course, don't forget to go live on we Facebook and YouTube page. You can connect to we on Redeemer Television. You can also watch and they, of course, the program we will watch now. STI is a major concern for the public. STI is a major concern for the public, and we don't go through a lot. I should say, you were to listen, you were to follow up with the program, don't learn a lot, and we want to continue. Of course, we get to Master Sabi person, yeah, so we don't empower we been on this file. So we want to continue and we want to know more concerning STIs, infection, and how it will affect the belongman them and self the picking way in go born. Yes, sir.
No man, I'm just trying for flatter. So as I been mentioned earlier, we get a group of congenital infections. Them we call it touch infections. Okay.
Mm-hmm.
They really not a cause of concern for pregnant people.
Mm.
So the T there is for toxo. So it is TORCHES. Okay.
Okay.
So we talk of the toxoplasmosis. So I be talk about what I say domestic cats and again. Okay.
Mm-hmm.
The form we ingest the cyst or the egg by the toilet of the domestic cat. So especially if you get in the first trimester, it can cause to the death of the fetus. In the third trimester, if you contact them, it can be highly chances for let the pikin get infected very high. But if person contact them before you get the belly, no harm, no cause for concern.
Before you get the belly.
Yeah.
So even during the pregnancy.
If it contact them before it gets the belly, and not they cause no harm.
To the picking. Okay.
Yeah, to the pikin.
Okay.
So some of the signs then when you go see in toxoplasmosis, that's where the pikin will get now what you call hydrocephalus. One hydrocephalus. I know say most of we don't see them picking the way that they born their head big.
Yes.
Yeah.
Yes.
So now one of the cause them dandy, okay? And also this one in the most common cause of blindness. You know me say other one they know they cause them.
Okay.
I can always try for be clear of what they see.
Yes.
So you know me say other bacteria them or virus not they cause blindness, but toxoplasmosis, whether a parasite or protozoan, okay, in the most common cause of blindness per pikin whether they born. Alright. Then it gets another effect when you call say it affects the pikin in mental status.
You get mental disorder.
Exactly. Alright. So these are just some of the rare cause of toxoplasmosis effect. So the own and others. So you get syphilis, hepatitis B, and parvovirus. Okay.
Okay.
Of course, syphilis in pregnancy not friendly. Even though out of pregnancy it can be somehow friendly, somehow. All right. So in pregnancy, one way where you can see where you be able to know say this pikin a mama go likely get syphilis. We get one way to call a saddle nose. Just like where they punch person nose, you understand? There are dents going inside. They find this common and also.
Okay, yes.
And also you don't see that name by
Yes.
mistake. So we call that the saddle nose. Okay. Another effect we to call the Hutchinson's teeth. Okay, the teeth they make like say it's go inside. They make the teeth they like the charm inside.
Yes,
Yeah,
in
exactly.
the like the short.
Exactly, like indented, indented inside. So syphilis also can cause and it can affect with gonorrhea. They affect the eyes. So they can cause what we call retinitis, infections of the eyes. Then it cause what we call rhinitis, the nose. They affect the nose. So in the nose they be inflamed, then they get runny nose, okay, in the pikin. So these are some of the of course, as I say, syphilis can cause neurosyphilitic manifestation. In fact, himself they affect the brain, and it affect the heart, the cardiac muscles. It causes aortitis, the aorta. All right. Also, it can affect the bones. The bones then can be inflamed. So mostly not so, because Salomon, we all want on doctor.
I tell you.
I see person in bone heart, man, not say person. I see picking in bone heart. Say that they get sickle cell. What's so? That's what I can talk about really much. I see bone heart, so I say it gets sickle cell. So sickle cell not so normally cause bone pain, especially the long bone they way there. This then yeah. Syphilis now one of the signs they say this pikia it gets a congenital infection that you born with that infection. They born with it. Now that we mean by congenital. And something they get in your developmental stage inside the belly.
Okay.
All right. So of course we get rubella infection. So right now we get the maculates that can mix then vaccines them, then give them as immunization for prevent. So
Because
you will find
I myself want to ask if we know they for prevent or cure them picking there so we can born with the infections there so.
of course then get treatment then for some.
For
All
some.
right, yeah. Expect well, even like for hydrocephalus we get a shunting system where they can insert, but not in a salon yeah anyway. So for salon pass you left your case giggled.
Yes.
But for outs, yeah, they advance.
Okay.
Then get away how they can do them. Alright. For let that big head, for let them control them, and let can down you live a normal life. But most of them they affect the ears, the fine, the patient, the picking can be mentally retarded, they able to focus, they be wise, they be dull, which you one I can say not get sense, can be slow. Alright. With syphilis they affect the reflexes, so the person they begin to become areflexia. So certain thing and the way you get the normal reflex actions then they will get up. So now some of the things then the way syphilis can do to begin. Okay. Even gonorrhea self they affect the eyes, as I say, retinitis. Okay. Himself they make let the pikin get a hearing difficulty. Also it can make let the pikin get some spots them rash in the body where they born with, and even the we as man or woman. So with gonorrhea you get the propensity, and syphilis for let you get rash. The rash they come out the body, the leg, take come to the testicle and the hand them. Okay. With that one they can also for man they can affect what we call the epididymis. The epididymis now that pipe we connect to the two testicles them. Alright, so it can affect them and cause inflammation in men. with woman them we get what we call urethritis, or they affect the vulva, right?
Yeah.
It cause inflammation of the vulva.
Okay.
Okay. So I will tap here. Yes.
Okay, so with all the sickness we don't call, is it possible for me person be treated to total recovery? You know, the syphilis, the gonorrhea, HIV and all the rest. Is it possible for me the one that also be treated to total recovery, or the person go for a day on medicine for life?
Well, it depends, especially for some of them totally treatable.
The total
Some of them totally treatable.
especially if they go earlier.
Especially if you become earlier, exactly.
Okay.
And even if you go late, there is hope for them be treated. Only that it don't cause complications then, but you can be treated for most of them, except with hepatitis B and HIV/AIDS. Okay, we then are manage with the manage them. We not get medication for treat them as yet.
Okay.
Yeah.
Okay. I just remember when you mentioned complications. If you say we go for answer the complications, you know, of the thing they are and waiting that they cause the body.
Okay. So as I mentioned, most of them treatable, with the exceptions of the
HIV.
viral cause. Viral, because I mentioned that we get the rubella cytomegalovirus, not also
Yes.
the herpes simplex virus, herpes 1 and herpes 2. Okay, so herpes simplex virus 1 and 2, the one they affect the moths, then the 2 they affect the genitalia. Okay, so one sign we have failed for mention earlier, symptoms, especially with the different type of sexual intercourse now we don't come. You know, so we don't create new things then we God not create. Alright.
Yeah.
So with gonorrhea, alright, and herpes simplex virus, if somebody where they do oral sex contacts them, it will get sore throat within 1 or 2 weeks. So one of the most common presentation they can say I get sore throat, like me throat a wound. Alright. So that one of the presentation and you will feel for mention. The question we just mentioned.
The complications.
Okay, the complications. One of the major complications is infertility in both man and women. It make you not able born. Okay?
Yeah.
Yes. So now you make mostly if you come to a gynae clinic, you tell you say, for me and my man or woman married, we don't try, when you get belly. We try for the intestine day, because one of the most common cause of infertility in both man and woman. Mind you, they say in both man and woman, because we country people that just feel say when woman are born.
Now
the woman
get problem.
the man is okay. No. So medically it's 50-50% chance. It's either can be the man or the woman or both.
Okay.
So infertility is the most common cause of them. So then now you come to the individual causes then. So as I be tell you, for man, like gonorrhea can cause urethral stricture. Waiting at urethral stricture.
Yeah.
It means say it just start like when you get this you candida, you wound them the well. Where the well waiting to happen. That's gone candida they form there.
Yeah.
And not they soft like this. So outside the wet they come out, where the gonorrhea wound the well and it forms strong and covering. Normally na a canal na a tract if for stretch. Because with the wet you use force, it push and come off for let the urine come out.
Yeah.
So if for stretch. So because you don't get repeated gonorrhea infection, you don't wound and well. So it form that side so that side where don't wound and well, you know the stretch again. Okay? So because you know the stretch, when you do wet, you get for use more force.
Wow.
Because that you know the stretch. So for like man, it make like way the wet all thing not the common. I make you can see some big man then all ten against that they smell like they piss by themselves.
Yeah.
Alright? And then they predisposed to it prostate cancer. Yes. So now the complications for man. So with that stricture, it is predisposed to prostate cancer, way more aggressive in the spread and kill person fast. Yes. Also, for the others like the syphilis, as I say, I be don't mention the other. So like it can cause ataxia, that the person not able balance in gates where they work like who that drunk, okay, and they cause aortitis, the heart, the cardiac, they affect the brain. With woman them also it can cause scarification of the uterus. You know, you get ectopic pregnancy, you get repeated abortion, you get the belly but in the waist. Yes, you know they able maintain the pregnancy because especially chlamydia, it don't affect that womb, the uterus, outside the pikin for the door, and it don't wound and well. So that scar, that kanda, now they become complacent or stretch for accommodate waiting for make let pikin grow inside the belly. So instead they cause repeated abortion. Also they cause what we call SGA babies. What we mean by that? Small for gestational age. Okay?
Small for
Gestational age pikin. They can also cause low birth weight baby. It can also make like you go into premature labor. So one major cause of infection that the tenor reach for like you born. So you born premature pikin. Alright? Mostly each pregnancy for, let us say this is not a term pregnancy for take almost 37 weeks. Okay? So anything below 37 weeks with the class I'm as waiting preterm, that you know reach to the time it's way for camp. I think these are the major infections we mostly can be presented. We can watch now we face them, but we not know, especially for women. You don't try for born, you get belly the waist, you get belly the waist, you get belly. Not all which man they be on you. Come now hospital, let we do test, and we go able help you rather than you to go for go pepper nurse or pepper treat yourself. Okay.
Okay, so we're about rounding up the program and we get one more bonus question for you. So let's create a scenario. There is a married couple. We are emphasizing on married couple, right? There's a married couple and one parent contact, or let's say get HIV, and yet they are married, and of course they no go separate because of the HIV, right? So how then go manage, this situation? The one partner gets HIV, and HIV, of course, in I sit on by himself, as you already talked about before. In I sit on by himself, the others like. But HIV is still by himself, and this one partner don't go contact her, and the other one no contact her, and of course no one contact her. But of course the marriage need for continue, the need for get a family and what's not. Is there a way for like me to manage this situation?
Well, that's a very complicated question you asked there.
Okay.
All right. So, bucketing they come into mind in that case. All right. One, they can go for use the barrier method. Okay. Condoms. Then they need for do a laboratory test for let them know the CD4 count of the person we infected.
CD4 count.
Yes. So now immunological test for let you know how strong your immune system dey.
Okay.
How far the damage the sickness don't overcome you.
Okay.
So if we pick them earlier, especially if at the asymptomatic stage or stage 1, because according to WHO for HIV/AIDS we get stage 1, stage 2, stage 3, and stage 4. Okay.
I think this is a whole topic on its own.
That's what I will tell you.
Yes.
So with that, then God's so good. We get like the receptors there for HIV in man. So you get the CCR4, okay, receptors them. When in they can use like a what I go say, like when you get that domot, the key. For let the virus enter your cell, you forget them. That's CCR4. For let it enter there.
Okay.
God makes some people they are mutated, they not get them. So even if they sleep with their partner, they know they get them. So then cases is don't come up at the clinic and they say, then go test the woman and say get HIV. But me this woman don't sleep, they test me, I not get. So one of the explanations can be that is that God make when they born you that side you mutate. You miss her, you not get her. Now that site that receptor the virus they recognize, they bind and enter inside the cell. Because how HIV they affect your cell, they come first, they use that key they open, they go inside there. Then you get your DNA where it go fix itself there. It take over. It begin produce a own particles there. After that way don't for produce your own particle, it break it come out and go affect a multiply, so they multiply rapidly. Okay, so some people they not get that. Also, if the woman they on medication, a compliant, and they do it in doctor say, at times the viral load it can be so low that you're not able to transmit them to nobody with proper treatment. Yes, it can be treated in a way that the viral load in your blood it be so low that you're not able to transmit them to nobody. You're not able to transmit them to pikin self wey get belle. So that animal cook is strict say when you then diagnose you say you get AIDS, not begin deny say I not get her. Take the medication like how they tell you. You can live a normal life and you can live long. Yes, with the medication if you take them like how they say for take them.
Okay, so thank you very much. I think we don't come to the end of the program. So before we draw the curtains down, you get any last message we want to send to the public outside, the public out there?
Well, according to WHO, they say 373 million new infections of STIs and 9 can get 9 they able to record for the year 2022.
300
73 million new infection, new. So you know mixed by the one day we for
we
20.
already.
Yeah. So that means in a menace and something we common. Okay, most people ain't get on than the one day we did not get on. So we advise that let people make them a habit. When you sick, go to hospital. Let them do tests. Then you say, boss, you can't tell you say, me it be at the Panadol I take. You self take Panadol. And not proper. Now that can make by the time now when you go to hospital, like at the talk about AIDS we get stages. If we able pick them earlier, we give you the treatment, you live a normal life. But it don't reach stage 4, there is nothing we can do. We just wait no more for the time we got the blow the whistle. Now that no more. So make them a habit for the visits the hospital. Not so bad people in the hospital. Not there for we self get people there. We're not gonna be happy for they go put sick by somebody we not get them. Because if we do that day, we can't share self. And the author will take not call for that day. Hey, we young people themselves will go to other medical people, where they will do the same. So please, that mentality they is wrong. So they just go to the nearest certified, not go to the mushroom clinic there. Not go to the Arab clinic there. Go to a certified clinic, please. Thank you.
Okay, boku thank you take your time and join me at the studio and at the program today. Boku thank you, really appreciate you. We don't learn a lot concerning STI and STD. So well fam, we don't come to the end of the program today, and we want to say boku thank to the studio manager Daniel Misali. We want to say boku thank to the camera operator Hannah Kanu, and to the VCR operator David Flomo, to the producer Daniel Morovia, to the technical team, Mr. George Campbell and Prince, and all who that join and for make the program meet you like I meet you. So we want to tell them boku thank you. So till next week Thursday, join me for another exciting episode. Me wait on be your host, Mina Shirley Rosalia Williams. Thank you. Tata.